Hello, everybody. My name is Dr. Chuks. I'm a consultant psychiatrist. If you like, you can call me a behavioral physician. Remember in my last video, I talked about the various symptoms of depression, where I mentioned that people who have depression usually have low mood, they have reduced or decreased energy, they have loss of interest in activities they used to enjoy or they used to like in the past. I equally mentioned that they have problems with their sleep, they have problems with their appetite, they have issues with relating to people, they like to stay alone, they like to stay by themselves and not having interaction with people. That is called social withdrawal and other symptoms that I mentioned. However, today I'm going to be dwelling on the types of depression. There are various types of depression, or there are various ways that depression can manifest in individuals. And that is basically what I'm going to be talking about today. So I'm going to start with the number one, which is major depressive disorder. In major depressive disorder, what characterizes this type of disorder is that it usually starts at least 2 weeks. So for you to say that somebody has a major depressive disorder, the individual must have been seen to be having symptoms of depression at least in the last 2 weeks. And the severity of the symptom may vary from mild, moderate, or severe. So when an individual has depressive symptoms, which has been there for a period of about 2 weeks or more, the individual is termed to have a major depressive disorder, a major depressive episode, if it is the first time that it's happening. Another type of depression is called persistent depressive disorder. Persistent depressive disorder. Now, in persistent depressive disorder, the individual must have been seen to be having symptoms of depression at least in the last 2 years. And the symptoms are usually milder as compared to the severity of the symptom that we can see in people who have a major depressive disorder. So in persistent depressive disorder, just as the name implies, persistent, meaning that the individual must have been having a persisting symptoms of depression, such as low mood, reduced energy, problem with sleep, appetite, and all other symptoms of depression. Please note that any individual who has depression must not have all the symptoms of depression that you know. The individual may have certain number of those symptoms for you to say that the individual has depressive symptom. So there are criteria for diagnosing depression, but that's for another episode of my videos. So for now, I'm talking about persistent depressive illness or persistent depressive disorder, in which the individual must have been having this illness or having these symptoms at least in the past 2 years. And the symptoms are usually mild. So some authorities call this illness dysthymia, meaning that the individual is not just feeling happy, he has just been there for several months up until 2 years on end. The individual has not really been feeling very happy with him or herself. So this is what is called a persistent depressive disorder. Another is called bipolar disorder or bipolar depression. Now, as we may know, in bipolar illness, an individual has a fluctuating mood. Sometimes the individual becomes very high and elated, becomes extremely happy, becomes very active or hyperactive, and sometimes they have these elevated feelings of importance or abilities. Now, at other end of the pole, that is the bipolar. Now, bipolar means two poles. Let's say one is on the left side, another one is on the right side. The one on the left side meaning that the individual is high in his mood, and maybe another one on the other pole meaning that the individual is very low in his mood. He feels very sad, he has reduced energy, reduced activity, he doesn't come out, he doesn't socialize, he has problem with his sleep, he has problem with his appetite, and a lot of other symptoms of depression. So this depressive side of this bipolar illness is what I call bipolar depression. So an individual who have bipolar depression, it means that at other time in their life, they can also have a manic episode in which they have something that is opposite of the depression, meaning they can have very elated mood, very high level of energy, very high level of activity. They engage in too many activities at the same time. They can even be so active that
sleep becomes a problem because they feel that they don't have time to sleep. So they stay awake most nights doing one thing or the other because of the overactivity that they have. So the depressive side of this illness is called the bipolar depression. Another type of depression is a peculiar type that is usually seen in children or adolescents. It is called disruptive mood dysregulation syndrome. It means that these individuals have problem in their mood, usually in children and adolescents. And what is seen there, they usually have this irritability. They are very irritable, and sometimes they can throw tantrums. So that's why you see in certain children, they have this outburst of anger, outburst of aggression, sometimes directed towards their siblings or towards their mother or towards anybody that is around them. This is called disruptive mood dysregulation disorder. Next is premenstrual dysphoric disorder. The women can agree with me that about a week or some days before their menses, some of them usually experience a dysregulation in their mood. Some may experience that just before their menstruation, usually up to a week or 5 days or thereabout before their menses. Some women will experience a change in their mood. They become very dysphoric. That is, they become a little bit sad. They may have low mood. They notice that they are not able to interact with people the way they should, and so on. They will generally notice a change in their mood, and this is what is called premenstrual dysphoric disorder, meaning that before menses, that there is a dysphoria, there is a feeling of unhappiness or a feeling of low mood among them. Now, what is also very important in this is that usually when the menstruation starts, the individual usually starts getting better, and over time, the mood problem usually ceases in those individuals. So most times it doesn't really require any medication or any treatment for these individuals. The next is depression due to a known medical condition or a depression that is secondary to a medical condition. In some individuals who have medical conditions such as diabetes, hypertension, who are actively on treatment, or people who have cancer or most other chronic medical conditions, they usually find out that they can have depressive disorders. So they can have low mood, reduced energy, loss of interest in activities, and other symptoms of depression. And this usually can occur as a direct effect of the medical condition that they have. At other times, it can also be possible that the treatment they are receiving for their medical condition may also be a cause for these depressive symptoms. So there is another type of depressive disorder. We call it substance-induced depressive disorder. Substance-induced depressive disorder. These substances can be hard drugs. They can also be medications that are used in hospitals. So whichever one, some of these medications can actually induce depressive illness in some individuals. People who use hard drugs such as cocaine, marijuana, or other forms of illicit drugs may notice that over time, depressive symptoms will start setting in, and that is what usually aggravates their use of substances. So in that case, they may increase their use of substances, thinking that they want to help themselves. Then in the long run again, depression can even increase, depression can even aggravate or worsen in these individuals. So the use of psychoactive substances, as well as the use of certain kinds of medications which are used in the hospitals, can as well induce depression in some individuals. The next type of depression is called seasonal affective disorders. As you can hear from the word seasonal, meaning that there are certain seasons, there are certain special times that depression can be elicited in some individuals. In Western countries, usually this is very common during winter periods, in which individuals begin to notice that every time of the year when you have winter, that they usually have these depressive symptoms that they suffer from. So people who have seasonal affective disorder will notice that each time the winter comes, they usually have this mood problem. They usually have depressive symptoms that disturbs them. So usually there are special ways to manage this kind of depression. So seasonal affective disorder is real, and it usually happens in a particular period of time during the year. In some other climes where there is no winter, for example, in our tropical African society, there is no winter. One can also have seasonal affective disorder. It may be during Harmattan season, or it may even be a particular time in the year. The individual will notice that their mood changes within that period for a period of time. The last but not the least type of depression is the postpartum depression. Postpartum meaning that usually after birth, this is found in women. Usually after birth, some women begin to develop symptoms of depression. This usually happens somewhere around 2 weeks or so after delivery. They will start noticing that they have very severe symptoms of depression. However, note that this does not occur in every woman, but we know that postpartum depression is very common among women, and it usually happens somewhere around 2 weeks after birth. And such women should be promptly taken for mental health assessment and care, because if this is not done, the baby is usually at risk of being harmed by the mother, who is trying to protect the baby from harm from the society. So the mother has the tendency to harm her baby when she has postpartum depression. So if you know a woman who has or who regularly has a postpartum depression after birth, please, this is the time to wake up. This is the time to direct such persons for mental health assessment and care. Thank you very much for listening. Please like, share, and subscribe.